Calling the Health and Human Services Committee 1 o'clock hearing, room 225 on March 2nd. We are here for GM's, governor's messages on nominations for various boards and commissions. With me is my vice chair, Senator McKelvey. And hopefully we'll have other senators soon. This hearing is being streamed live on YouTube. In the event that we may have technical difficulties, we will be rescheduling it on March 6th at 1 p.m., room 225, for those matters, for those GMs we are unable to hear today for various reasons. We also have the ability to go on YouTube, and in the unlikely event, we apologize if we do not pronounce your names or it's not transcribed correctly. We will do our best. And with that, we have GM 533, Laura Mallory Sayer for the Emergency Medical Services Advisory Committee. Laura, are you available on Zoom?
I am, but my video has been shut off, so I need to have your technician open my video, please.
Okay, IT, can you turn on Laura's video?
Will do, Chair. Asking them now.
There we go.
Okay, aloha.
Good morning.
Okay, good morning, and thank you very much for applying and being nominated for the Emergency Medical Services Advisory Committee. And we have all of your answers to our questionnaire, as well as a substantial resume. And I'd like the committee to know that I personally know Laura Mallory Sayer's huge work on the Lake Sayer Foundation, and her immense ability and her heart in order to continue ensuring that our medical services, that the fire department has the equipment needed. But with that, Laura, why do you want to work, why do you want to be in the Emergency Medical Services Advisory Committee?
Well, I'm very excited. This would be my first gubernatorial nomination, and I've been wanting to work with the state for some time and seeing what we could do to be of help. I have 28 years of working with emergency personnel on the Big Island, and over 2 now with the Maui Fire Department. I have 5 trucks coming in just this week, and one of the reasons I couldn't be there in person. So we have 2 big dogs coming for Maui, and we have 3 ocean safety trucks coming for the Big Island. We have altogether 29 trucks that we have been able to purchase, jet skis, rescue boats, hangars, where, it's just, I have a vast amount of experience with dealing with EMS equipment. We're purchasing 3 Lucas chest compressors for the engine trucks here on the Big Island, where the ambulances cannot get there in an immediate amount of time. I'm excited about the opportunity to serve the state as well as the counties in my capacity as an executive director for this foundation, but more importantly as an individual. I'm a dental hygienist by profession, and we know that the body is really important to keep alive. And that's why we do what Frank and I do in dentistry. I'm wanting to save lives. This is my passion. That's my mission for the foundation. And anything that I can do to assist Chief Hall in his efforts with the Emergency Advisory Committee, I'm willing to do. And I have a great connection with all of you, Joy. As you mentioned, I'm very close with my senators and representatives and my council people here on the Big Island. And now I'm developing relationships on Maui as well. We just got Lifelight Network to partnership with us. For the first time in the history of our island, we actually have critical care transport from our island to Oahu to provide critical care to people who normally would not make it on this island because of the lack of expertise. We're excited about that, and you know, I want to see more ambulances on the Big Island. We need them here. We're unlike any other island in the state, and I want to make sure that we're able to meet those needs. Plus, the statutes, rules, and regulations haven't been looked at for 40 years. I mean, it's 1984 was the last time any changes were made, and we need to update these rules, regulations, and statutes to be current with the times and the technology. I also am very familiar with the procurement process and how that has been onerous for the counties and the state to get the equipment they need in a timely fashion. So I want to work with Chief Hall on those problems as well. You know, I'm excited about serving. Would be a really amazing opportunity for me to share my expertise and hopefully make a difference, not just for our counties, but for our entire state.
Thank you so much, Laura. And I know the Big Island has really benefited from you and Frank's services. And it's good to know that you're also allowing your generosity and your expertise to extend to Maui. So with HHSC, not HHSC, with the Emergency Medical Services Advisory Committee, you folks are in the position to create policy throughout the entire state. And your experience with the Big Island, and as you know, before you got your foundation, the lack of resources that were there, and the limited resources, and now the challenge that's happening in Maui, and probably the rest of the state, you have the ability to lend your expertise to shape that policy. So I do appreciate your willing to serve.
Thank you.
Do you have any questions?
No, I agree with you 100%.
Okay, we're not gonna do DM right now because we don't have quorum, so we're gonna move on, Laura.
Okay, thank you so much. Should I leave the meeting now?
It's up to you. How does this work with Zoom?
As far as
No, okay, so
You
yes, you
can
can leave it now and then we'll let you know what happens.
Okay, thanks so much.
It seems to
I
me that
think you'll
everybody
be
is in
fine,
support,
yeah.
so we just need quorum though.
did you want to do DM immediately after they testify?
We cannot, we have no
Well, I can
quorum.
have Senator Kanua come.
No, we'll finish it off.
Okay.
Okay, thank you.
Yeah.
Thank you guys
Thank you,
so
Laura.
much. Appreciate it. Bye.
Okay, bye. Okay, next, we have State Rehabilitation Council. Cynthia Mew up for consideration. Cynthia Mew, are you present on Zoom?
Yes, I am.
Okay, please proceed. Let us know why you want to be in the State Rehabilitation Council.
I've actually been doing the job on a temporary basis for the last 2 years. I have 44 years with the Department of Education, and in the last 3 years, I've been working with DVR on trying to find jobs for our students with the most significant disabilities.
Okay.
So, yeah.
Yeah, thank you very much. Thank you for willing to step up in the interim. And it does look like you have the capacity and the experience to help out with your special education resource education teacher, as well as your current experience with the State Rehab Council. So you know that we really need people like you to help us shape policy, right? So thank you very much. Any
Thank you.
questions, Senator McKelvey?
No, I'm good.
Okay, moving on. Next, we have Amanda Luning for State Council on Developmental Disabilities. Amanda, come on up. Excuse me. Lynn, I need to call you later. Sorry. Come on up. So Amanda, I see that you work with the Hawaii FASD Action Group in Kaneohe. Why don't you let us know why you want to be in the State Council on Developmental Disabilities?
My I'm a Hawaii kid. I'm a local kid, and I've worked in a lot of different spaces, kind of birth to death, in the sense that I've had a lot of experience. I'm a marriage and family therapist by training, in relationship to kind of a keiki to kupuna concept and multi-generational things. And when we think about developmental disabilities, I think a lot of times it's sort of framed from a pretty limited way of understanding it. And I kind of hope to be able to expand a little bit what we mean when we're talking about developmental disabilities, not just in relationship to, let's say, regulation, but also the family support element and the way in which people, when we get the right kind of care and the right kind of support earlier and sooner, that ultimately that really helps everybody a lot. And I know that from my worked experience and my lived experience. And I just hope to be able to bring some curious questions and connect some dots in a different way.
Okay, thank you very much. So as you heard previously, volunteers such as yourselves in various committees help us shape policy in the state. And so we rely upon people with lived experience, with the kind of experience that you do have. Do you have any questions?
What do you see as the biggest challenge in front of this commission the next year, in front of the DDC community that you might be able to effectuate?
I think really the way that we identify what early supports look like, because we've had historically some really significant limitations around the way that we identify folks who need things like care and support. And so not only kind of really looking at what that means, but then also understanding that we pay at some point. Yeah. Either we pay now or we pay later. And if we understand that earlier intervention, earlier identification, earlier support ultimately reduces complex comorbidity, reduces cost to all of our systems. I'm a preschool teacher, really, in my heart, right? And that's where I saw when kids were not getting what they needed sooner. And then I went to working with the prison and adults and rehabilitation and all these kinds of things as a mental health clinician, as a trauma clinician. I'm like, we can do better sooner. I just really think that when we identify what people need sooner, I'm a prevention person. And it ultimately, we know upstream is less expensive. We know it's better for families. We know it's better for overall people's ability to do well. And so I think really looking at how we identify what people need sooner who may be struggling with developmental disabilities that we historically have not are going to be some things that we need to look at.
And identifying the developmental disabilities sooner. Right?
Absolutely.
Okay, thank you very much.
Thank you, Chair. Appreciate it.
Okay, thank you very much.
Thanks, guys.
Okay, moving on. We have, and for all of these nominees, we have had no opposition testimony. And I should have mentioned earlier, for Laura Sayer, GM 533, we had Hawaii County Council in support, Holeka Inaba, James Eustace in support, Sarah Medeiros in support, Kelly Wall in support, Kelly Flair in support, Diane Quidiquit in support, Ian Chadwick in support, and of course, Dr. Sayer, Tina Clothier in support, Claudia Graham in support, and Mary Andrews in support, and Marilyn Matsunaga of EMS Advisory Committee in support, Bud Quidiquit in support, and Michael Shattuck in support, Linda Rosen in support, and Mariko Sakita in support, David Okita. He's a Big Island helicopter, has had to rescue a number of people, also in support. Dr. Graham, Dory Ingalls in support, and Jesse Eversole, firefighter in support. For state rehab council, for Cynthia Mew, we had Department of Human Services in support, and that's it. And for Amanda Lunan, we also have Louis Urchik, Hawaii Disability Rights Center in support. And that's it, but no opposition. Next, we have GM 711, Marisa Celeste, of State Council on Mental Health. Come on up.
Good afternoon.
So why is it that you want to be in the State Council on Mental Health?
I feel that I can bring the voices of other people with lived experience, to the table. And also the certified peer specialists. I have their voices be heard as well, as often goes unheard.
And I appreciate all the volunteer work you did. But a lot of it was in California.
Yes,
When did you move here to Hawaii?
2020.
Okay. And
And I've been a part of the Hawaii Clubhouse Coalition of
Oh.
Advocacy.
okay, so that wasn't in here because a lot of this, your resume kind of ended in California and I didn't see anything in Hawaii. So Clubhouse,
Yes.
which Clubhouse?
Diamond Head Clubhouse.
Okay, well, I like the clubhouses.
Good.
Yeah,
Yeah.
I think they do a really good job of giving support to those who are,
Yes.
who need support and who are mentally ill.
Yes, I enjoy going to the clubhouse.
Okay, so I also see, so do you expect to do the kind of well, this is a volunteer work, so do you expect to use your experience in California? It looks like mostly Southern California.
Yes.
Yeah, LA, Van
Los
Nuys.
Angeles County.
Yeah, apart.
San Fernando Valley.
Oh, well.
So why did you move back? Why did you move here?
I had to get away from an abusive situation.
Oh,
So if there was a good place to come running to, Hawaii was a good, far enough away place that they wouldn't come looking for me.
okay. And, okay, do you have any questions of Marisa?
No.
Okay, moving on. Hannah
Okay, thank you.
Thank you very much. Hannah Preston Pita, Statewide Health Coordinating Council, and I would like to disclose the committee. I also know Dr. Hannah Preston Pita.
After this one, you will have to go back.
Okay, I'm sorry. I thought I did, sorry. Hannah Preston Pita, are you present on Zoom?
Yes, I am, and I cannot release. Oh, there it is. My camera's on.
Okay.
Hi,
why don't
Senator.
you-
Hi, everyone. Aloha.
Okay, so Hannah, why don't you tell us why it is you want to be in the state health planning and is it SHIFTA? Yeah, it
That's
is.
why he's here.
Statewide Health Coordinating Council. Okay, all right.
Well,
Okay,
thanks for the
Hannah.
opportunity. Thank you so much. I'm honored to appear before all of you today in support of my nomination again. So this would be a continuation of my term. I have served. I seek to serve because I care deeply about our healthcare systems. I want to make sure that I am the voice for Hawaii Island or Mokuoke'awe, especially in rural, underserved areas, which is what I like to do. On Hawaii Island, we really feel the real time consequences of workforce shortages, delayed infrastructure, and I know I'm talking to someone who really knows about that too as well, and the fragmented behavioral healthcare systems. And I'm hoping that my experience as a leader on this island, providing full continuum of care for substance use and mental health services, will be the voice for people that I serve. I bring about 15 years of executive leadership experience navigating licensure, accreditation, all the fun stuff, managing state and federal funding, building facilities, and opening up the first and only detox center on Hawaii Island. So if I'm confirmed, I will approach this role, as always, with integrity, data-informed decision-making, and commitment to ensuring that Hawaii Island's voices are included in statewide planning conversations. Mahalo.
Okay, thank you, Hannah. Also in support is Shari Lynn, Brian Baker of Hinamauka, Heather Lusk of Hawaii Health and Harm Reduction Center, and Hawaii Substance Abuse Coalition also in support, and SHIPTA, Dr. Lewin in support.
Chair Santana Ventura, Vice Chair Kelsey, members, honorable members. Yes, Hannah is a great advisory member for us. I mean, she has a doctorate in education. She's a licensed clinical psychologist. She's an activist supporter. She's also the CEO of the Big Island Substance Abuse Council. So she serves a lot of really interesting connections and roles for us and offers a lot of insights and advice. And we highly value her participation with SHPTA's Advisory Council. So thank you very much.
Okay, thank you very much. Anybody else wishing to testify on Hannah GM 557? Seeing none, moving on. Cynthia Mew, I apologize for bypassing you. GM 569, State Rehabilitation Council. Cynthia, you present on Zoom? Cynthia?
Present, Chair, but I believe they've already spoken.
They already spoke, yeah.
That's what I thought. I thought you
Yeah, we
already
had her.
spoke.
She's a DOE person from 40 years experience.
Thank you. I got a note saying that she didn't speak. Thank you.
Hi, Cynthia.
Thank you. Sorry, Cynthia. Okay, thank you very much. And I did say DHS stated in favor.
Yes, correct.
Okay, next we have, after Hannah Preston Peter, and thank you for that, Vice Chair.
No worries.
Okay, Joy Cortive, GM 529, HHSC, Board of Directors. Joy, are you present? Please
Yes,
proceed.
I am. Hi, everyone.
Hey.
Please proceed. Why is it that you want to be part of the Board of Directors of HHSC?
Sure. So I am a born and raised lifelong resident of Kauai. And, as a lifelong resident here on the neighbor island, I would love to serve the community in representing them on the HHSC corporate board. I hope to bring my business experience, communications expertise, and my community volunteerism experience to what I can contribute on the HHSC board.
Okay. So Joy, I'm looking at your resume,
Yes,
and it looks like you're mostly into PR.
correct.
So why HHSC?
So I think first and foremost, HHSC, just because of I'm a member of the community, and we know here on the neighbor islands how rural healthcare can be a beautiful thing, but challenging. But for PR purposes and where I can contribute the most is with communications consulting and my business experience as a business owner. So that's how I'll contribute to the board.
Okay, for your communications experience.
Yeah.
Okay. It looks like Ed Chu of HHSC is in strong support, so he believes that your experience will help him in the board. And that's it. Any questions as to Joy Corte, Public Relations?
A quick question for you, Joy.
Sure.
From how do you see your ability as a PR person to help with messaging to rural communities about the services that HHSC does, and also to ensure that concerns and issues in the rural communities are being channeled and responded to by the HHSC?
So in my work, I do a lot of consulting for nonprofit organizations or also philanthropists. And in those roles, I get to see a lot of times the need and the gaps of healthcare just because of our philanthropist issues in contributing to healthcare. So I can, and then coming from the resident's perspective, I know what it's like to, need a specialist, have to fly to Oahu, have to seek emergency services with a medevac. And so I feel like I know what our community is looking for, what they need, what they experience, and then I can help HHSC with communicating with them in the most effective ways to all of their publics, including, staff, just everyday patients, and the community at large, even donors.
Okay, thank you, Chair.
Okay, so frankly, Joy, it doesn't look like you have any health background other than your work in the PR, public relations. So a lot of the problem with HHSC is that the state wants them to be more self-sufficient, right, and not asking the state for more and more monies. Will you be, I'm assuming that that's the reason you got picked here, is to help them with your business background, because it doesn't look like you have a health background.
I'm not a healthcare professional or have a healthcare background, but I have a lot of experience as board member with the Ohana Pacific Foundation, which does adult daycare. Several of our clients have been nonprofit organizations serving the community in health. For example, Malama Pono Health Services. HHSC was a former client of mine as well. So I feel like I have that background and understanding of the business and the community perspective. And so I think, yes, you're correct that I am brought on to help with this sort of transition and messaging. And also I bring the strategic philanthropy perspective. So I work with a lot of donors and can help on the fundraising side as well.
Okay,
That's fine.
that's probably why you're in it.
That's
Okay, thank you very much. Okay, next we have anybody else wishing to testify on GM, excuse me. Sorry, what was it? 529. Anybody else? Okay, moving on. Come on up, Ed Chu. I called
Yeah,
you.
you called you, man.
mentioned it in passing, so I thought, oh, you skipped over me.
Okay, please proceed. Now you can explain why you
Okay.
nominated him.
Oh, good afternoon, Chair, Vice Chair. Thank you for the opportunity to provide testimony and strong support for Joy Curtie's nomination to the HHSC Board. I'm Edward Chu, President and CEO for HHSC. Since Joy was made an interim appointment by Governor Green late last year, she's been a very active participant in our corporate board meetings and in our Kauai regional board meetings. And her expertise in public relations, and particularly as we look toward the future in terms of how HHSC tries to become more financially viable given the current healthcare climate, I think her business background and her strategic communications and philanthropy experience really is going to be invaluable to us as we move forward. We are currently working on our strategic plan for the next 5 years, so I think her input is going to be very valuable to us. So with that, I'll stand on my written testimony, strong support.
Okay, thank you. Anybody else wishing to testify in GM 529? Okay, seeing none, moving on. Okay, GM 538, Alan Novak for, excuse me, SHPTA, right, Hawaii County. Okay, first up, Alan Novak, are you present?
Yes,
Okay.
I am.
Okay, please proceed.
Okay. I have been an advanced practice registered nurse in the state of Hawaii for almost 50 years now. Started out on Oahu, have experience working at Hawaii State Hospital and in the outpatient clinics for the mental health division. Ran the psych unit at Castle Medical Center. It was called the Human Services Unit for 7 years. And for the past a little over 30 years, I have been in Hilo, and where I have my own private solo practice, seeing chronic and severely mentally ill individuals. I have been able to maintain a small group of them from being hospitalized in over a decade. I am in semi-retirement, so I'm not taking new patients. I haven't taken a new patient in the past 15 years, but that's why I'm down to a small number. And I simply cannot find a way to discharge the patients I have been seeing, because I am certain that they would end up in the hospital again if I did. I have been involved in various healthcare issues. I was on the Windward Planning Council for SHPTA when I was living on Oahu. And I've been involved in a number of other issues and policy decision-making groups. And I feel like my experience in healthcare, as well as being able to see the overall broad picture, spectrum of what needs are, and as well as having in the trenches, if you will, where the rubber hits the road, experience working with patients on a neighbor island where there is a strong shortage of providers and difficulty in accessing health care among the residents. I feel I can be helpful in terms of developing policies that address those issues.
Thank you very much, Alan Novak. Okay, in support is SHPTA. Dr. Lewin.
Good afternoon, Chair Santaventura and Vice Chair Kelly. I've been very pleased to know Alan Novak during my tenure as SHPTA administrator. He's offered lots of feedback to us in many ways. Not only is he a clinical instructor for the University of Hawaii, but he's also, and the Hilo College of Pharmacy, but as he says, he's been involved in many, many aspects in healthcare. He is one of the authors, you should know, of the primary care bill that came in. He was very much involved back in trying to look for data for that. So he's very involved in healthcare. He's really responsive to the community. He's a leader among the advanced practice nurses. He'll be a wonderful advisor to us.
Thank you very much. Next, we have Dr. Grosskreutz from the Hawaii Healthcare Task Force in support, APRN Mickey Mura in support, University of Hawaii Manoa, Dr. Kelly Whitty also in support. Anybody else wishing to testify on GM 538? Okay, seeing none, moving on. GM 702, Michelle Kauhine, Hawaii Planning Council, West Oahu sub-area. For, I believe it's, come on up, Michelle.
Aloha kako. Just a quick correction. My last name is Kuahine, not to be mistaken for Michelle Kauhane, who I dearly love as well. But
I apologize.
no worries. Happens all the time. First, mahalo to you, Chair San Buenaventura and Vice Chair McKevy for your time and consideration. I really mahalo you, and I feel so honored to be here and have this opportunity to appear. Why I applied to be on the council, why I think I've learned over the years that having a seat at the table is important. But most of all, West Oahu is my community. It's my home. I've raised there, still live there. I work at the Waianae Coast Comprehensive Health Center. I've served there now for, over 35 years. Time flies when you're having fun. But I started there in direct patient care as a medical assistant. So I have seen firsthand the social economic challenges that impact our community's health and well-being. And I also have seen how health policy, health planning decisions can make an impact. And what I want to make sure of is that our community needs are articulated and brought to the table accurately. And so if confirmed, I will approach this position with integrity, fairness, and a commitment to ensuring thoughtful decision-making and make sure that it's well-informed and it truly reflects our community's needs. And so, again, I'm truly grateful for this opportunity to serve, and I'm happy to answer any other questions you might have.
Thank you very much, Michelle. Any questions?
Just a quick question from the Chair. So do you see from your West Oahu experience is the number one issue facing your community that you think SHPTA should tackle or look at or be involved in?
What I always think about is, number one, what has bothered me over the years, some things change and some things don't. One of the things that hasn't changed is that unfortunately our communities are number one in diabetes prevalence in the state and obesity on Oahu and obesity prevalence in the state, and that's wrong. I know that there's no easy answer, right? Because it stems from a lot of things. We serve the highest number of Native Hawaiians in West Oahu, and so there's a lot of historical components that impact, right, the health and well-being of our community. So I think we need to look at it from a broad lens. if we can't move the needle on diabetes, why is that? Well, because we know that there are health-related social needs that impact, right, a person's ability, so an individual as well as their family, their ability to stay healthy. And so I really see looking at things outside of health care itself, but workforce development, economic development, bringing opportunities into our community. And so I'm hoping that I can bring kind of a bigger lens and explaining really the real life challenges that our individuals and community members are facing daily.
Especially rural healthcare, yeah?
Yeah. Geographically, right? I mean, we're not considered technically rural, but we really are. One road in, one road in, one road out. And so, yeah.
Thank you very much.
Mahalo.
Okay, next.
Common theme of the western parts of the United States.
Yes. Dr. Lewin in support.
Yes, I certainly am. I thought when you said, what do we do to help Shibda, she would say, get a younger administrator.
Yeah, well, tried that earlier.
Chair and Vice Chair, we recruited Chrissy to come for this job at this time. She's kind of the heart of Waianae Coast Comprehensive Health Center, but she's really an expert in IT and electronic health records and
I saw the telehealth
and all sorts of technology issues. And not only are we in need of a lot of assistance and advice with respect to the AHEAD model and other things we're doing, the Rural Health Transformation Program really needs the kind of advice that she can offer us. So we're so grateful to have her services at this time. We think it'll be super helpful for the Waianae community, but also for other rural areas of the state where she will have expertise that we're going to borrow. So we're really delighted to have her.
Thank you very much.
Strong advocate for the payers to provide for telehealth services.
Okay, next we have Waianae Moku Navigators in support. Sun Global Super Wireless, Dr. Miyataki in support. Molokai Community Health Center in support. Daniel Gomes of Waianae Moku Navigators and Waianae Coast Comprehensive Health Center in support. Rich Bettini in support. Anybody else wishing to testify on GM 702? Members, any questions? Okay, seeing none, moving on. GM 548, Radiologic Technology Board, Kevin Kaneko. Kevin, are you present on Zoom?
Yes, I am.
Okay, please proceed.
Let's see. Is
Yes,
my
we
video
saw
working?
you.
It's the
1 second. There we go.
Yeah.
Hi. Good afternoon, board. My name is Kevin Kaneko, and I am being considered for the RadTech board. I was born and raised here in Hawaii. Worked in the RadTech. I've been an X-ray tech for about 20 years now. A graduate from the KCC program, which is the primary producer of X-ray technologists in Hawaii. As a worker at Straub, I work at Straub Benioff Medical Center. I've been here for about 19 years. And so far I enjoyed the program so much, and I was so appreciative with the education that I received that I am one of the preceptors for the KCC students that rotate through here, which I work closely with. There are certain changes that occur that need to be addressed with the students, and so I'm kind of like a liaison for that. I feel like because I work closely with the KCC instructors, and also if I'm going to be considered for this role, I can be a good bridge between the education, the state standards, and also what's required nationally. Not nationally, I'm sorry, across the U.S. Unfortunately, I believe that there's a shortage of X-ray technologists in Hawaii. Many hospitals are hiring out of state. They're hiring travelers, paying a lot of money for that. And I think that's a real disadvantage. But I want to make sure that rules and regulations that we follow as a state. Let me refresh that. I'm sorry. With all the outside people coming in, we want to make sure that our standards are being met locally for our residents. Because we're hiring from outside, I want to make sure that, we're not losing those standards. And with the advancements in technology coming about so quickly, I feel like the certain regulations that are currently I guess, that are current are not up to date, and they need to be reviewed, make sure that they're still following the advancements of technology. And that's where I want to, I guess that's where I want to contribute my efforts.
Thank you very much. Okay, for GM 548, we have State of Hawaii Department of Health and Support.
Good afternoon, Chair and Vice Chair Matt Carano on behalf of Department of Health, Environmental Health Services Division. We just want to stand on our testimony in support of Mr. Kaneko. Thank you for his service. He's already been serving as an interim. Everything he said is exactly accurate, and we're going to try hard with the board to redo our rules and stand up and get some really good people. So thank you for the consideration. Questions?
Okay, thank you very much. Next, we have Stephen Louie in support, Chris Kojima also in support. Anybody else wishing to testify on GM 548? Members, any questions? So I do. So I like the fact that you pointed out, Kevin, that the staffing shortage is one of the issues you really want to look at. But also, you know, we're facing AI, right? And we really, the legislature really depends upon boards and commissions to help us with policy. And that's why we look at your experience and what you can contribute for the board to help us with this. Do you think you can help us with that? I mean, with especially now with AI as a sort of, I don't know whether or not it'll help us with staffing shortages or whether or not these.
I think the AI portion of it is more directed, probably more towards the radiologists, the people who are reading the X-rays. I think that's going to affect them more. I'm on more of the side of the technologists. So when patients come in, I actually do the X-rays. I take the X-rays of them. I don't read them. But from my experience over the past 20 years, I kind of got the tail end of the old technology, which is the film screen technology, which is very outdated now. It went from there to computerized, which means that rather than film being in those cassettes, it's a reusable, like white linoleum, reusable type of material. But now it's DR. So as soon as we take X-rays, they automatically get imported and pop up on a screen, and we can make adjustments and we can see if we need to repeat anything very quickly. Radiation doses have gone down a lot in order to produce good quality images, which is excellent. But there is a slightly downside to that in that we never want to set the parameters for the exposure. We always want to try and make sure that we expose enough to produce a good quality image, which means that sometimes trending can go higher. We might be exposing patients a little bit more than what's necessary. Yes, we don't have to repeat as much, but you know, if we consistently start upping our parameters, the dosage in the community is going to go up. So that's what I want to avoid, things like that.
Yeah. Okay. Thank you very much. Any other questions for Kevin? Okay, moving on. GM 549, Reiko Nakamoto, also for RadTech Board. Reiko, are you present on Zoom? Okay, please proceed. Let us know why it is you want to be on the Radiologic Technology Board.
Hi, good afternoon, Chair and members of the committee. My name is Reiko Nakamoto, and I'm licensed radiologic technologist with certifications in radiography, mammography, and breast sonography. I have over 12 years of clinical experience and have worked closely with quality assurance and regulatory compliance standards. I'm honored to be considered for appointment of the State of Hawaii Radiologic Technology Board.
Okay, thank you very much. Okay, also testifying for Reiko are Department of Health and Support.
Chair, Vice Chair, member of committee, Matt Carano again, Department of Health, Environmental Health Services Division. Same as with our previous, Reiko has really helped us. It is an interim appointment, and she is going to be serving on the board at a time when we do need to look at our rules and our regulations, like she said. And we look forward to her on the board, should she be confirmed. Available for any questions. Thank you.
Chris Kojima also in support. Jairus Kuniyuki in support. Stephanie Higa in support. Anybody else wishing to testify on GM 549? Members, any questions? So I do. So Reiko, you have an interesting resume. You're
Yes.
VP of Dragon Balls Bar.
Yeah.
What's that?
So if we have family businesses, and so my mom's the owner, and I help, take care of the other things that help assist with her, with operations and that sort of thing.
Okay, so you help out with the administrative side. What about
Yeah.
Himuro Inc.? You're also VP
Yes.
of that.
Yeah. So it's pretty much like 4 businesses that I help out with.
Yeah, it looks like there's also Mr. Ojisan Neo Sushi and Bar and
Yes.
Tokyo Inc.
Yeah.
So you know what? Tell us what you do for it, because we also kind of need to know whether or not you have time for this. Yeah, because
Okay.
you're also a regional. Yeah, you're doing all of that. Plus, you are the VP, which seems to me pretty high up of these 4 businesses, right?
Yes. So I started off as being a dishwasher. Of course, it's my my mom's business, so I had to, go into different types of roles and understand how everything works as part of the operational side of it. And then for many years, I was doing the accounting, like payroll type of thing. And recently, I kind of stepped down because we opened up all these other businesses and there's a lot of other responsibilities. So I kind of took a step back, but I have to maintain my VP status just in case, things happen in the future that I can take over.
Okay, so these are family businesses.
Yes, 4.
But you're primarily a radiologist with Star Benioff.
Yeah, I'm a radiology technologist, and I work primarily in the mammo department doing mammographies and breast ultrasound.
Okay. Members, any questions? Okay, seeing none, moving on. Okay, next we have Jeffrey Hicks, Juvenile Justice State Advisory Council. Jeffrey Hicks, are you present on Zoom?
Not present, Chair.
Jeffrey Hicks, are you present at all? Okay, we're gonna move that DM to Friday.
Okay.
For Jeffrey Hicks. That's GM 560. And next we have GM 563, Sarah Antone for Juvenile Justice State Advisory Council. Sarah Antone. Oh, hi. Come on up.
Good afternoon.
Okay, please proceed. Let us know why you want to be in the Juvenile Justice State Advisory Council.
Sure. Well, I appreciate the opportunity. I have been on the council since 2019, and it aligns a lot with the work I do at Catholic Charities Hawai'i. I oversee our youth services division. So it gives me an opportunity to, in my work, I oversee contracts across multiple agencies, and this gives me an opportunity to bring that perspective to the council as well.
Okay. Next we have, and thank you for filling out your questionnaire. It gives us an insight as to why you want to serve, yes?
Sure.
Okay, we have Catholic Charities also in support. Anybody else wishing to testify on Sarah Antone, GM 563? Members, any questions? Okay, you seem very qualified. Thank you very much. GM 706. Mental Substance Abuse Council, Mental Health and Substance Abuse Kauai Service Area Board. First up, we have Priti Tayal. Priti, are you present on Zoom?
Not present, Chair.
Okay, she's not able to make it. Okay, so her DM will also be moved to Friday at 1 p.m. Okay, next we have GM 546, Waianuhea Getjan, for Maui Service Area Board, Mental Health and Substance Abuse. Waianuhea, please proceed.
Aloha.
Aloha. Aloha. Okay, why do you want to be in the Mental Health and Substance Abuse Maui Service Area Board.
Mahalo for having me today. So I am a licensed marriage and family therapist. My area of focus is primarily with children and adolescents, though I do service and support adults as well. I'm a Maui girl, so born and raised from here, very passionate about providing mental health services to our community. I've worked directly in school systems as well as in private practice. And I think I have a really unique perspective on some of the areas of strength that our system has, as well as some of the areas of growth as well. I think specifically for the island of Maui, we have just some unique things that our community has experienced in recent years that have significantly impacted the mental health and well-being of our community. And so it's something that I'm really passionate about and would feel honored to be able to serve in this role.
Okay, thank you very much. Members, any questions? Okay, can we do it? Yes, we will. And I did say it, but I'll announce it again. Okay, members, can we move on to decision-making?
We may.
Okay, as stated earlier, we are going to move GM 560 and GM 706. Their decision-making, that's Jeffrey Hicks and
Give me a second to catch up to you.
Preeti Tayal.
Okay, wait, 560, you said?
And 706, it's
I'm
in
just
the
going to
back.
pull the vote sheets real quickly. 560.
And 706 will be for Friday, March 6th at 1 p.m. in room 225.
Got it. Okay, I think we're good.
Okay, so moving on, so let us, for GM 533, Laura Mallory Sayer, Chair's recommendation is to advise and consent. Any comments, questions, concerns?
Okay.
Seeing none, Vice Chair for the vote.
All right, recommendation on 533 is to advise and consent. Of the members present are noting the excused absence of Senator Keokaloli and Senator Pavella. Are there any WRs or no's? Seeing none, recommendation has been adopted.
For Cynthia Mew, Chair's recommendation is for State Rehab Council, GM 569. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation is to advise and consent of the members present. Any WRs or no's? Seeing none, recommendation is adopted.
GM 551, Council on Developmental Disabilities, Amanda Luning. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the
Okay,
vote.
recommendation 551 is to advise and consent of the members present. Any WRs or no's? Seeing none, recommendation adopted.
GM 711, Marisa Celeste, for Council on Mental Health. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation is to advise and consent of the members present. Any WRs or no's? Seeing none, recommendation has been adopted.
Okay, GM 557, Statewide Health Coordinating Council, Hannah Preston Pita. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, on GM 557, recommendation advise and consent of the members present. Any WRs or no's? Seeing none, recommendation adopted.
GM 529, Board, Hawaii Health Systems Corporation Board, Joy Corte. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation on 529 is advise and consent of the members present. Any WRs or no's? Seeing none, recommendation adopted.
Okay, GM 538, Alan Novak, Hawaii County Sub-Area Health Planning Council. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation is advise and consent of the members present. Any WRs or no's? Seeing none, recommendation adopted.
GM 702, Michelle Kuahine, Health Planning Council, West Oahu Sub-Area. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation is advise consent of the members present. Any WRs or no's? Seeing none, recommendation has been adopted.
Kevin Kaneko, GM 548, Radiologic Technology Board. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation on 548 is to advise and consent of the members present. Any WRs or no's? Seeing none, recommendation adopted.
Reiko Nakamoto, GM 549, Radiologic Technology Board. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation is to advise and consent on the nomination of the members present. Any WRs or no's? Seeing none, recommendation has been adopted.
Sarah Antone, GM 563, Juvenile Justice State Advisory Council. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendations on 563 is to advise and consent of the members present. Any WRs no? Seeing none, recommendation has been adopted.
GM 546, Waianuhea, Getchen. Chair's recommendation for Mental Health and Substance Abuse Maui Service Area Board. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendations on 546, advise and consent of the members present. Any WRs or no? Seeing none, recommendation has been adopted.
And with that, congratulations to all of you.
Congratulations, you guys.
And we are adjourned.